pleasant good day to each and every one of you, and thanks once again for joining us here at the Information Command Center here at the studios of the Government Information Service. You can follow us each day on the National Television Network as well as on the Facebook page of the Government of St. Lucia and the Government of St. Lucia YouTube channel. We are also live on WVNT 93.5, and again, we welcome all our listeners to this frequency. Today, we'll be discussing the topic, talking to your children during this global pandemic, COVID-19, and we also place a spotlight, on our very important essential workers, particularly our nurses. But before we do that, let's just bring you up to date on the latest development here at our Information Command Center with respect to St. Lucia's response to COVID-19. As of May 8, 2020, St. Lucia has recorded a total of 18 confirmed cases of COVID-19. 17 are fully recovered and have reintegrated into their communities, and one active case is currently in hospital care and is recovering well. On Friday, May 8th, 2020, results for 45 samples were received and they were all negative. This brings a total of 620 tests conducted here in St. Lucia thus far. And on Friday, May 8th, 2020, the Ministry of Health and Wellness received into quarantine 219 St. Lucians who are cruise ship workers from the Carnival Glory and Caribbean Princess. These nationals were taken into quarantine where they shall remain for a period of 14 days as per country protocol. We also have news that another group of St. Lucian nationals will be repatriated Tuesday, May 12th. And later on during the program, we will be receiving some more information on that. So we do ask you to stay tuned as we bring you this latest development. We also see the continuation of the National Meals Program, which continued over the weekend, on Sunday in particular, for the most vulnerable among us. And this took place across the island. And we want to say a special thank you to NEMO, the St. Lucia Hotel and Tourism Association, the St. Lucia Cadet Corps, the Department of Agriculture, the various constituency and disaster preparedness councils, and the volunteers for continuing to make this as seamless as possible. We've taken some photos from Bill Motley of yesterday's delivery efforts as spearheaded by the St. Lucia Cadet Corps, and we also spotlight one of the kitchens involved, June's Kitchen. Do we have those images ready, Roger? Okay, there you go. So those are some images you're witnessing right now from yesterday's National Feeding Program. The packages being loaded by the National St. Lucia Cadet Corps and then transported to the various constituencies to be delivered by the various disaster preparedness councils, the various constituency councils for the most vulnerable persons across the island. Of course, this program started on April 12th and will be continuing throughout this pandemic and hopefully even beyond that, because we know that even after the pandemic, there will be persons who need to be taken care of, need to be fed, who cannot fend for themselves. So those are the images you're witnessing right there, the offices of NEMO in that photograph on screen right now. NEMO working very hard in the background. And as I indicated, spotlighting one of the many kitchens involved in the feeding program. Those photos are from June's Kitchen. And of course, our very talented chefs from the various hotels, the various restaurants, preparing those food packages to be distributed across the island, as I've mentioned. So those were just some of the images, and we have quite a lot more footage from our national feeding program, and those photos were taken yesterday. We say a very special thanks to Bill Motley for providing us with some of those images from yesterday. We take a break, and when we come back, we continue the discussion here at the Information Command Center.
Coronavirus? I am worried, Gassa. It's only old people dying from that.
Hold up. Being young does not mean being safe. Yes, it's true that the elderly are at higher risk, but anyone can get the virus. The effect is even worse if you have a chronic condition like hypertension, heart disease, lung disease, and diabetes, or weakness in your immune system. If you are living with these conditions, be extra careful. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol when hand washing is not possible. Avoid touching your face. Take steps to boost your immunity through proper nutrition, exercise, rest, and take your medication as prescribed. Limit being around people who have flu symptoms, even close family members.
Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
And welcome back to the Information Command Center here at the studios of GIS. Joining me in studio today, and no stranger to our command center, she's been here before, is the Director of Human Services, who's also the head of the Stress Management Response Team, which falls under NEMO. Did I get that correct?
Yes.
Thank you very much. So just tell us a little about what has been set up. I know we've been through it before, but just before we go into our topic today, which deals with talking to children, what has been set up in terms of psychosocial support as St. Lucia faces this pandemic?
Okay. Thank you, Mr. Nicholas, for inviting me to the studios again today. As we proceed, as we continue through this pandemic, we recognize that there are many areas that we still need to discuss, that people still need assistance with. One of these being exactly what you spoke to, psychosocial support. What has happened in St. Lucia as far as psychosocial support through NEMO and the Ministry of Health, a team has been set up where we have various numbers which can be called to get some psychosocial assistance. So these numbers have been circulated and persons are free to call them. We also have the other numbers which are already existent on island. That's our 311 for general information. Then we also have the 202 hotline for domestic violence and the 203 hotline for suicide intervention. So these numbers are all in effect and are being used by the public.
Mm-hmm. Today we are speaking specifically about talking to children at this time. What is the first thing that a parent, a caregiver, a provider should know?
Okay, so when we're speaking to children, one of the first things that we need to remember is that we need to look at the age of the child and obviously the stage of development, because depending on the age of the child, the manner in which we speak to them, what it is we say to them, how it is we express it, is going to be very important. So my discussion today really is going to focus on younger children, I would say between the ages of 5 and 12 years old, where you really want to speak to them in a manner, at their level. You want to speak to them at their level so that they understand exactly what it is you are saying to them. One of the first things that as parents or caregivers, maybe even teachers, now that we do in online school, is that a lot of times we take it for granted, or we don't think that the children understand what is happening around them. They may not be able to articulate it, but there is some level of understanding. And so it's very important for us to listen to what it is they have to say and not shut them down or think that what they are saying is not important. So listening is one of the first things that we as adults need to remember when it comes to speaking to children. So before we speak, we need to actually listen.
It's very interesting what you said there, but then how do we equip the parents, you also mentioned teachers, in having that capacity to listen, to pay attention, to pick up on the signs?
Okay, so first we do that by making the child feel safe. With everything that is happening around us, with the changes in schedules, changes in routines, changes in caregivers, lots of changes happening, we have to ensure that the children feel safe. So how do you do that? By telling them that everything is going to be okay. By telling them that they are going to be taken care of. Because just like adults, the children are concerned about themselves, their families, and their loved ones, those who are closest to them. So by reassuring them that we love you and we are going to continue caring about you in spite of the changes that are happening, so you help them to feel safe. The other aspect about it is giving them facts. There are a lot of myths going around, and especially in the beginning of this pandemic. Now it's a little bit more settled. People have some more facts and can really speak to things that are truthful. And so it is important for us to actually let the children know the truth about certain things. Having said that, though, you don't want to provide too much information that they don't know what to do with that information, that they become bombarded. So, for example, if a child asks a particular question about something, you can answer it. You may have more information about it, but if that child doesn't ask, then it probably means that they're not processing to that extent to come up with a follow-up question. And at a time like that, it may be important to just withhold that information because the basic general facts have already been given. So in that way, their brains are not constantly working and moving forward, still not understanding what is said because they have too much information.
A question of not overloading them.
Exactly.
Okay. What are some of the challenges you see children having, or we expect children to have at this time?
Okay, one of the many challenges is that at this point, children have rights, and one of these rights is the right to having information, as I've mentioned. But as with any right, there comes a certain level of responsibility. And what we need to understand about children is that with that level of responsibility also comes a certain level of power. Now that I have the knowledge, I am responsible for that information, and I'm responsible for what it is I do with that information. So when we teach a child to wash your hands for 20 seconds, that child now has to become responsible for their safety. Okay? So you give the information, the child receives the information, and now the child can have the power to be able to use that information in a way that is going to help keep them safe.
Now let's talk a little about, we have many children among us with special needs.
Yes.
How do we deal with that situation?
Okay, that is where empathy comes in. That is where we now have to remember that not every child is the same. And so we should not expect the 5-year-old, the very active 5-year-old, okay, who always likes to run and jump and everything, to suddenly become a very quiet child because they have to stay inside. Because we're in isolation, because we're in quarantine. It doesn't work that way. That child is still going to be very active. And so the same thing with children with special needs. We now have to determine, how do we get that information across to them? In what format do we get that information across to them? So simply saying it might not be sufficient or might not work at all. Can we model it? So you bring the child to the sink and you show them how to wash their hands. You sing the happy birthday song so that they know the length of time that it takes in order for the hand washing process to be something that is effective. So you make it playful, you make it joyful, you make it entertaining. You make it in such a way that is something that the child enjoys and therefore would remember to do. So that was just one example of the hand washing, but it can be done for other COVID-19 messages that we want to bring across to children as well.
As a country, as a state, what is our role and responsibility when it comes to protecting our children during such a pandemic? We saw, for example, just about a week ago, that famous river line where persons were arrested. Among that group, reportedly there were children and that were being exposed, even if we have all the protocols in place and what have you. What is the role of the state when it comes to protecting our children and keeping our children safe from being exposed?
The role of the state has not changed much. We are still responsible for our children, and as you would very well understand, the protocols have been put in place not just for adults but for children, so for the general population. So now what needs to happen is that the adults in society, parents, caregivers, guardians, and even older siblings, aunts and uncles, need to all come together as part of the responsibility that you talk about, need to now come together to ensure that the children that are under their care understand the protocols and understand the reason why it is important. So you see, I mentioned modeling earlier. If we as adults don't model the behaviors, don't model what it is we want to see, what we are telling our children to do, then they are not going to do it. If a parent believes, oh, well, it's not in my community and nothing is going to happen to us and there's fresh air by the river and so on, and they go on this river line, the children are going to follow suit. Sometimes it boils down to less than modeling. It boils down to what we say, how it is we say it. So in a community last week, the river Lime happened, and the parent is like, oh, but there's nothing wrong with that. And why are the police doing whatever? The child now hears that and figures it's okay. Their parent is now endorsing it, and so they figure out they can do it. Okay? So we also have to be careful what it is we say and what message what we're saying is sending across to our children. So to go further into the state's responsibility, so again, when we look at it on a state level, we have different levels. We have the police, we have Division of Human Services, we have the judiciary. So of course, the same processes would go through. The only difference is, because of the physical distancing, we now have to tweak the manner in which we have contact with person and the manner in which we approach the judicial system. But the protocols have remained the same, and for the cases that we have received, they have been working pretty well.
The children, like most of us, going through their phases of anxiety, particularly at this time. Let's just take a look at this short video talking about the coronavirus and minimizing anxiety when it comes to children. Roger, just give me a little volume, please.
During any crisis, it's very important to minimize anxiety and panic. So when talking to your child, model calmness. Younger children in particular will look to their parents for how to respond and how to feel. So when we're calm and reassuring, they'll pick up on this. Think about what your child absolutely needs to know, because giving too much information can heighten anxiety. So think about what is age appropriate and work with the understanding that they already have. So for younger children, say around 6, you might want to talk about germs and how people are getting sick. Whereas for older children, stick to the facts and correct any misinformation that they may have had. Don't dismiss or minimise your child's fear. So it's important to understand how they may be feeling. Talk openly and honestly about any questions they have, and also don't make it a one-time conversation. Emphasise to them that they can come to you at any time if they have any questions or are feeling worried. Younger children in particular should have minimal exposure to news broadcasting around the virus. Sometimes the media can use language that can be scary or frightening for younger children, and so translate what they need to know in an age-appropriate way to reduce anxiety. One of the best ways to empower young children is to teach them everyday actions about how to stay healthy. Teach them the importance of hand washing and to use their elbow or a tissue if they need a sneeze or cough. This can help them have a sense of control and talk to them about any actions that the school may be taking. And finally, while tensions are high, it's important to stay positive and to show kindness to others.
Okay, we saw in that video several tips on how parents can minimize anxiety with children. We stand to reason, like I said earlier on, that our children, like the rest of us, will be experiencing some measure of anxiety. Care to comment?
Yes, and that is very important for us to recognize what translates as anxiety in an adult may not necessarily be how it comes to the fore in children. So in children, we might see things like constant fighting with siblings. Now you might say, but that's normal, but you have to look at the frequency of it, you have to look at the intensity of it. So fighting with siblings, throwing tantrums, not wanting to eat, not sleeping properly, regression, where a child who was already potty trained is now wetting the bed again, memory lapses, just being disobedient, and all of these, which seem pretty normal in a child, can be the signs of anxiety simply because they are not symptoms that were present in that child before the pandemic occurred. So we have to be very vigilant in terms of what it is our children are doing, how it is they are presenting to us, and also to listen to them, as I said earlier, listen to what it is they are saying. How it is they are saying it to you. Are they asking questions that are genuine questions, or are they asking questions that maybe they overheard somebody saying something and they're just repeating it, regurgitating it? So we have to be very vigilant in terms of what it is the children are presenting in order for us to be able to understand what is happening with them.
Mm-hmm. Our children are now learning from home at this time, the third term. Again, what should the conversation be like for them, with them, in terms of how long again before they get to be with their peers at school, how long again before they see their teachers? Some of them really have that connection with their teachers. What sort of conversations can we have with them?
Okay, in terms of that, again, we have to look at what is available to each child. So while we might want to speak about it generally, some of the ways to be able to deal with it may not be things that are available to every child. So for example, the children are at home. The same way for adults, we spoke on a previous show about developing routines, maintaining routines. The same thing is important for a child. So if you as a parent are working from home and you've developed that routine for yourself, now that your child is at home, they also need to develop a routine, or you assist them in developing that routine so that they have their online time, they have their study time, they have their downtime, their playtime. So in place of a break at school, you could have yard time, or you could have, something that keeps them active, something that is similar to what it is that they are accustomed to. In terms of meeting up with their friends and so on, we spoke about social media, using the social media platforms, especially those that have the video aspect, so that in spite of the physical distancing, the social aspect still remains. Having said that, though, what we recognize is that there are recommendations for the amount of screen time that any child should have in 24 hours. But we recognize with the COVID-19 pandemic, that amount of screen time has drastically increased. In spite of the fact that it has increased, what can happen is that the parents now, guardians, whoever is with the child, can monitor and determine exactly what is happening on that screen. So it's not the same thing happening all of the time, but rather different activities, which would have a different feel, a different sense. So it's really, yes, using the screen, using the phone, the tablet, the computer, but it's a different activity. And so the way the brain is going to take it in would be different, and so that is what is going to make the difference in terms of the increased screen time that we are now seeing with children.
In many instances, we're dealing with less than ideal situations, particularly for the parents. While some parents may be working at home trying to cope themselves, we know that many of our parents are now unemployed. They're now faced with the backlash that came with COVID-19 and the whole global pandemic. And it poses its own set of challenges in terms of them having to deal with their kids or even speak to their kids.
Yes. Yes. So you spoke earlier about the anxiety. There's also fear. There's also the fear of the unknown. What's going to happen? When are things going to get back to normal? But the question is, what really is normal? Are we ever going to get back to exactly what it is we knew? It seems highly unlikely, and just in reading and doing some research, it seems highly unlikely that we're going to get back to exactly what we knew before. There will become a time where we will go back to a sense of normalcy, but it will be different to what it is we knew. And so I think at this point, we need to understand and we need to start thinking in those terms. Because as anything else, we operate on a continuum. We start at the beginning, and once we continue to move, things constantly change. So change is the only thing that is constant. And so we have to now understand that as things change, we adapt and we normalize it. It changes again, we adapt and we normalize it. It's the same thing that's going to happen with this pandemic. And for persons who are now, you know, have lost their jobs and so on, it's a distressing time. It's a really distressing time. And to find ways of coping is what is important. To start thinking ahead. What is in store for my future? What can I do to start generating income? Whether it be getting another job, whether it be working from home, whether it be using online platforms, whether it be entrepreneurship. So thinking ahead, what is the future going to be like for me? What can I do? Along with whatever assistance, social assistance that government is providing, or maybe assistance that some employers are providing, how it is I can merge all of these things to start moving forward into what is now going to become, you know, normal for me.
You used a word earlier on that's really important, empathy.
Yes.
It's something I think we all either need at this time, or we need to show and express to others and let them know that, you know, we're going through this differently, but the situation is affecting each and every one of us in one way or the other. We just speak a little more about the empathy we all need to show, especially to our children and as well as the parents, because they need that empathy as well.
Yes, one of the things I've recognized is with parents who have been coming into the division, and also the calls that we are getting is, what do I do? How do I cope? And in a lot of situations, it's not that they're not aware of what to do, but it's just that they need somebody to help them along, to move them along, to speak with them. A lot of times we have the ideas in our head, but until we speak it out loud, it is just an idea. And so just as I'm saying that we have to listen to the children, we now in the helping profession have to listen to the adults. Listen to what their cares are, their needs are, what are their concerns, and how it is we're going to help them to change that from a concern into a plan. What are the steps that we are going to take for that plan now to be executed to get to a goal?
We take a break now. When we come back, we continue our conversation, and we'll also feature an interview with Ms. Alicia Baptiste, who is the president of the St. Lucia Nurses Association and principal nursing officer with the Department of Health. Do stay tuned for that.
With all that's happening around us, simple adjustments are necessary to keep us all safe. When calling 911, we may need a little more information to deploy the right personnel and protocols. You may be asked about your travel history, signs and symptoms, contact and movement history, and whether others in your household are exhibiting similar symptoms. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
And welcome back. We continue our conversation here with Ms. Beverly-Ann Poyotte of the Department of Human Services. Ms. Poyotte, what has been the interaction like with your various district counselors, their ability to respond to any calls within the communities where, in particular, our children are concerned.
Okay, so you're speaking specifically of the social workers.
The social
within,
workers,
within
yes.
the department. Okay, so the department at this point, we are operating on a scaled-down basis, of course. However, the social workers remain available to assist the public. The numbers for all of the social workers have been posted at the respective offices, and so members of the public are fully aware of who to call, where to go in order to get assistance. Social workers have been working on a case-by-case basis in the sense that emergency situations are dealt with just as that. In as much as physical distancing is part of the national protocol, there are situations and circumstances where we as social workers have had to go out into the field to conduct investigations and to do home visits. So all of that is being done while taking the necessary precautions. Counseling continues, and we are using telecounseling, which is a new area for a lot of persons. And I dare say it is quite a learning experience. I've actually just this morning had a discussion in terms of, starting to look at some training, because this might very well be one of the things that becomes our new normal in terms of doing teletherapy. And so I'm going to be looking into how it is we can now have that as part of our general repertoire of services that we offer. So social work continues on the ground. Calls are coming in. For children in foster care are being checked upon, and reports are being made both to the Division of Human Services and to the police. We continue to work with the police on those cases as necessary.
It's funny that you mentioned the whole teleconference and what have you. One thing that immediately came to mind, we've been hearing over the years, especially in the cases of domestic violence and where children are involved, we've been hearing about the possibility of having some of those court cases via video conferencing.
Yes.
Do you foresee that possibly with the advent of COVID-19, this might push us quicker into having this thing resolved and this becoming the new norm for us?
Well, we already have it before COVID-19. So what has happened is that it has, the usage has increased. Courts are using the video conferencing to conduct court. Up to this morning, I was in discussion with the courts to see how it is we can continue that process in a manner not just looking at high court cases, but magistrates court cases and so on. So we already have the equipment, because we were doing the video conferencing for specific cases that needed it. But as you rightly said, it might very well become something that we do on a normal basis. So right now it's just about looking at maintaining our equipment and possibly looking at other avenues. So instead of the teleconferencing that we're using, how can we just use simple Zoom, the Zoom platform, or maybe even WhatsApp platforms where you can have a call with 3, 4, 5 persons at a time. So yes, so these are things that we are exploring, and we think we've had to use it on a limited basis, and we think that it has been quite effective.
Although we are speaking primarily today about our response in terms of dealing with our children, but something that struck me during an interview I had earlier with Ms. Lucia Baptiste is that our nurses and other frontline workers, they too have children.
Yes.
And they too are trying to cope, and they too need the empathy and the counseling and the guidance. Just speak a little to that.
And so what that means is that the frontline workers, you speak specifically of nurses, but all of the frontline workers, some of these persons have actually been away from their families, because with the physical distancing, it doesn't make sense to have all of the protocols and then you have this individual in and out, coming in and out with persons in the home who may have underlying conditions and whatever the situation is. So in addition to childcare issues, we also have issues of physical separation. And so it is important for us to reach out to them, to provide the psychosocial, for them to reach out to us, not be afraid to say, I need assistance. It could be simply to talk. It could be simply to say, you know, I haven't been sleeping well. It could be simply to say, I'm really tired and I need a day off. But for them to reach out to us as well. The other aspect of that is for managers and supervisors of frontline officers to understand the dynamics behind the individual whom they are working with. So yes, I'm a nurse and I'm going in to help. But when I come into work as a nurse, I may have my family on my mind. I may have my children on my mind. Okay, I may have other issues on my mind which can now have an impact on the work that I'm doing. So it's important for managers and supervisors themselves to recognize that whatever is being given out there, okay, would also be impacted by the mental state of that individual. And so again, that is where the empathy and the understanding comes about. So managers and supervisors now also have to ensure that the manner in which they deal with their staff is not going to make the situation worse.
Mm-hmm. You mentioned not being afraid to ask for the help, not being afraid to come forward. Do you think that as a society we have matured in terms of removing the stigma associated with seeking psychosocial support and mental well-being and what have you?
I think it is slowly. The stigma is still there, but I think very slowly that stigma is being broken down. And I'll tell you why I say that. The Employee Assistance Program, which the government has put in place, I think it's about 4 years now that this program has been in place. And it's a program of counseling, therapy, and debriefing, which has been put in place for public servants, public officers. We have actually seen an increase in the number of persons who are coming in seeking counseling. Mm-hmm. One of the reasons that we find that there's stigma attached and people do not seek it is because they always think that there's a lack of confidentiality. Mm. And so in setting that program up, the issues of confidentiality were taken into consideration. And so persons are able to come in and get that assistance. Likewise, what people need to understand is that the counselor is aware of those issues. And so the counselor, bound by ethical considerations, would have to maintain confidentiality. Unfortunately, you know, when there is one spoiled fruit in a bag, everything else seems to go bad. And so if you have one situation where there was a breach of confidentiality, all counselors now get painted with the same brush. This really is not the case. Mm-hmm. And so, yes, the stigma is still there, but I would just like to say to persons that call. Even if you're just calling to say, to ask, where can I find somebody that I can trust mm-hmm. to speak with? Mm-hmm. Yes, you may know a private counselor. Reach out to that person. Some people don't call because they think that counseling is very expensive. Not necessarily. And especially during this pandemic, I know many private counselors who are actually assisting people for free. Mm-hmm. Okay, so make that call. Arrangements can be made if the person is still requesting for payment, some sort of payment. Arrangements can be made as far as that is concerned. Referrals can be made if you live in the south and you happen to call somebody in the north. Arrangements can be made for you to see somebody down south. So all of these little things would be taken into consideration. And so again, the psychosocial hotlines that are in place, these are the numbers that they can call right now in order to get that assistance.
Okay, sounds very good. As I indicated earlier on, we spoke earlier today with Ms. Lucia Baptiste, who is the president of the St. Lucia Nurses Association and principal nursing officer with the Department of Health. Let us take a listen now to what Nurse Baptiste had to say during this aforementioned interview.
Dealing with COVID-19 has been a very difficult experience. Because again, you would know it's new to us. As even though we as nurses have seen other pandemics before, but never like 19. And it was difficult in that our nurses at that time was very fearful, and rightfully so. And but I think with our training and experience, I think as nurses we were able to pull ourselves together and work, ensuring that our patients got the best care, and of course that our nurses were protected at all times.
So in short, you're saying that our St. Lucia nurses have definitely risen to the occasion at this critical juncture in our history.
Oh yes, definitely. They have risen to this occasion. I can tell you that. I could speak, for example, where I manage at the Dennery Hospital, and can tell you that the nurses came to work every day. I had no sick leave from nurses because they understood they needed to be there for the people of St. Lucia.
As a country, what do you think are some of the takeaways as a people we could gain from this whole experience and the response by our nurses?
Okay, what we can learn, take away, one of the first things I would say, adhering to protocol. We must be able to trust our personnel within the Ministry of Health, and I want to take this time to say thank you to a great leader, our CMO. And if we follow these protocols, and you can see over the few months that adhering to this protocol have kept us with the numbers at a certain in a certain number, you understand, and that was very important. We must understand at all times we must take the lead from our health professionals. So I think that is one of the things, and if our people would keep to protocol, the social distancing, the washing of hands, we would definitely be able to flatten the curve.
I'm going to hope that the answer is no, but I'll ask the question anyway. Have you heard of any reports of any of your nurses being discriminated against in any way?
At the beginning, yes, because we had nurses in uniform where you'd have some bus drivers not wanting to take them. Certain places they would go and they would get persons shunning them, you know. But I think after, as hospitals and healthcare institutions, we developed the protocol of them not coming in uniform. And this assisted also with the, for example, Massey stores would give special time for the frontline workers. So we would go in, do what we have to do and leave. So I think people have now understood these are the very nurses who have to go and care for our people, and people after a while understood the situation.
Your final message to St. Lucians at this time in terms of our response to our very critical frontline workers?
We want to thank St. Lucians, those who have adhered to protocol, those who have encouraged us, those who have reached out to us, the many food outlets who have reached out to us. We want to say to you that we will continue, because our aim is to ensure that we have no deaths on this island. And we will continue to give our best, but we also want you to stay home for us so that we can stay at work for you.
Very important message there, Nurse Lucia Baptiste, and that was ahead of International Nurses Day, which happens to be tomorrow, May 12th. And of course, you could join us here on NTN for the broadcast of Ms. Baptiste's message to nurses tomorrow as part of International Nurses Day. We have a call right now. We have a very important person on the line right now. As I indicated earlier on, we will be speaking about another batch of St. Lucians who have been repatriated to St. Lucia, hopefully tomorrow. Good afternoon, caller.
Hi, good afternoon, Tony.
Okay, so we have online with us Ms. Jermaine Georges from the St. Lucia Tourism Authority. How are you doing today?
I'm good, Tony, I'm good.
Okay, so you have some more great news for us where our cruise ship workers are concerned?
Absolutely. So thus far, we've repatriated a total of 228 St. Lucia nationals. The first batch was on the 21st of April. They have come, done their quarantine period, and are now home with their family and friends. And on Friday, we saw the repatriation of 220, with a total of 208 coming in on Carnival Glory and another 12 on Carnival Princess, and these 12 were tendered in. Tomorrow morning, we will see the return of Carnival Glory, bringing in another 20 St. Lucia nationals who were aboard Carnival Corporation vessels out in Barbados. So they were on various vessels of the corporation, and they've all been put onto one vessel, and they'll be brought into St. Lucia tomorrow. They will be tendered into Port Castries, where they will be received and immediately placed in quarantine at the Castries Public Health Facility as per our protocols.
So that's the second batch. Do we foresee any more coming in later this month, sometime next month, possibly?
We're looking at the 24th and 25th as it relates to bringing in the next batch. We're working with the cruise lines in that regard, and we're just awaiting final confirmations. Of course, we must ensure that the protocols are adhered to. So that includes ensuring that the health and safety standards are met ahead of entry into St. Lucia.
Just speak a little about the intricacies involved in doing something like this, because we know we have, like you mentioned earlier on, a number of those cruise ship workers in different ports. The coordination, some of the ports are closed and what have you, the different organizations who work together, who collaborate to ensure that those persons are brought home or repatriated safely.
Well, it takes an amalgamation of efforts. So it's quite a bit of us working on that. You have the Ministry of Tourism, External Affairs, Ministry of Tourism Authority, SLASPA, Invest St. Lucia, of course, Customs and Immigration, and we cannot do it without the help of the Royal St. Lucia Police Force. So it's quite a bit of effort. There's a lot of dialogue with the cruise lines, a lot of dialogue with the embassies. Of course, permissions must be granted here and there. The Center for Disease Control must get involved. So there's a lot of logistics that we must follow to ensure that everything is observed in terms of the health and safety before we can say, yes, it's time for you to come home.
Okay, sounds quite interesting there, Jorin.
So that the quarantine, quarantine space is of concern to us as well, and we must be able to manage and function with the Department of Health and Wellness as it relates to quarantine and the quarantine processes.
Understood. Well, thank you so very much for that bit of information, and we do wish you and the entire staff at the St. Lucia Tourism Authority all the best. We know that you guys are working very hard behind the scenes, ensuring that everything goes through as smoothly as possible.
Thank you, Tony. It's a pleasure.
So there you have it, folks. St. Lucia, we will be welcoming another batch of our cruise ship workers back on island tomorrow. And as per protocol, they will be taken into quarantine immediately upon their arrival, 14-day quarantine, and being taken care of, being fed and housed, and being taken care of by the government of St. Lucia. Something just occurred to me when she was talking about persons coming in. On the one hand, some of those persons, their families, we've been talking about anxiety earlier and looking forward to them coming home. But then we have the other aspect, they're coming home, but they're going into quarantine. So that probably creates another level of anxiety. Again, some of those families, some of them, they have children who they may not get to see immediately. That's another level where, again, we're talking about speaking to our children during this COVID-19 pandemic.
Yes, yes. And so you very well articulated it in terms of the various levels of anxiety and the various, how it is that there can be multiple levels, even with one individual and with one family. But I always like to tell people that when situations like that arise, let's look at the positive side of it. So yes, they were out there, you could see them video call, but they're one step closer to home. So now that they're in quarantine, while they are still in quarantine, they are closer to home. And quarantine really is going to help both the individual and the family, so that upon reintegration into the family, that 14 days, what it does, not only does it allow for us to see whether there are any symptoms or anything that, any illness that the person may have, COVID-19 related, but it is also going to allow us that peace of mind that when they're reintegrated into the family, that everything is okay, as opposed to them just coming home and going to the family, and then you still have some kind of stigma and probably even discrimination that certain family members may not want to interact with them because of the uncertainty. So the quarantine, while it is still 14 days away, it allows for a sense of relief, a sense of comfort that yes, they have spent the 14 days, they have had the medical attention that was required, and so we know when they come home that everything is going to be okay. So when you look at it in that way and you look at the positive side of it, it really helps you to realize that it's really for everybody's benefit.
You keep mentioning positives, and that's something we've been hearing a lot from the psychologists and what have you. A number of us, on a daily basis, taking a lot of the negative news. We become overconsumed by, downloading a lot of negativity, the deaths, the impact, all the negativity. And even in that short video we watched earlier on, relating to talking to kids about, the pandemic, it speaks of, avoiding allowing your children to watch too much of the news, where, again, you get so much of that negativity. So just speak a little about us placing ourselves in a position where we absorb more of the positive as opposed to the negative.
Okay, so it all has to start with your mindset. It's a conscious decision that you have to make. We spoke about maintaining routines. What is your routine as far as social media, as far as the TV, as far as news, radio? What is your routine as far as that is concerned? If it is that within your routine there is unlimited, then that you need to scale back on. Simple example. Just turn off your phone for 1 hour. And within that 1 hour, do something fun and exciting. Or maybe just relax. Maybe just watch a movie, watch a funny movie. For some people, they like to watch cartoons, okay? Just that 1 hour is going to give you some time to rejuvenate, to recharge, okay? And it is the same thing for children as well. Just a few minutes, playing outside, playing in the dirt, playing with pets, whatever it is. And so first it starts with the decision that I'm going to look for the positive in every situation that comes my way.
And that is so very important. Thank you for sharing your wealth of experience here with us today. Final thoughts to our listeners, our viewers?
Okay, so my final thoughts today, I just want to share a quotation that I got from Hartsfield, and it says, take this opportunity, this COVID-19 opportunity, take this opportunity to reflect and make some positive changes to what is now going to become your new normal. Slow down and do things that you enjoy. Play games, read books, snuggle, cuddle, cook together as a family, and connect authentically. And I would like to add to that, tell stories. Tell your children the stories of when you were a little child, what you did growing up, where you went, the things that you did. Take your albums, your photo albums, go through them, show them their grandparents, their great-grandparents, and in that way, you are doing something that is relaxing and also something that is educational and something that is bringing your family together.
Thank you so very much for sharing that with us, Ms. Beverly-Ann Poyotte. And let me just once again express heartfelt thanks for the hard work, the feeding program being put on by NEMO, the St. Lucia Hotel and Tourism Association, Events Company of St. Lucia, as well as our cadets. We've seen the photos, we've seen the videos, and they're really going all out to ensure that our most vulnerable are being taken care of during this pandemic. Again, to all our children and young persons, we say that we are with you, we are here for you, and we are going through this together with you. But we need to continue to follow the protocols of staying at home, washing the hands, sanitizing, using the face mask, and all the other protocols. And remember that this too shall pass, and as always, continue to remain safe, St. Lucia.